Hi, everybody. It's Nicole. We have Marina here and some of her special guests. We've got Stephen, Ezra, and Melanie, and they're going to talk to us today about Project Turnaround. She was nice enough to let me record this session for everybody so that you can watch it if you weren't able to attend. If you're sitting in on this meeting and you're a volunteer, I will be entering this in Optima for you. If you're watching the recording of this, please make sure that you enter it in Optima on your own. So that being said, I'm going to turn it over to Marina. If you want to introduce yourself, maybe tell us a little bit about yourself, and then we can jump right into the presentation.
Perfect. Thank you, Nicole.
Thank you.
My name is Marina Caballero. We've had a lot of changes recently, and I haven't got a chance to tell you, Nicole. So I've recently moved into the youth programs coordinator position. So I'm no longer the coalition coordinator. Well, I'm kind of doing both right now, but until we get other staff on board. But I will be in this new role under our YPU, YPI programs, which is a sister program to Project Hope. And I've been with the agency since February, so I'm still fairly new and getting to meet everybody. And I have a couple of our prevention specialists that provide the different services and curriculum here that I'm going to present to you guys. So I wanted to include them because they're the ones that are out there providing this information to our kiddos and parents and stuff like that. So I'll go ahead and get started and share my screen. Bear with me just a second. Let's see. Can y'all see this? Thumbs up, okay. Let's see. All right, so like I said, we are from the Coastal Bend Wellness Foundation. We are one of many programs here at the Wellness Center. We have a lot of different services. We have our clinical services, community health outreach, Pride Center, client services, behavioral health, and our youth programs. Those all fall under the foundation. Our clinical services, we are a federally qualified health center. We do adult primary care, pediatric care, both for insured and uninsured patients. We do have an on-site pharmacy that we have here in our building. We don't turn anybody away, so anybody that we can kind of help and provide services to, whether or not you have insurance, that's kind of where the clinic comes in. They do a really, really good job. We have our community health outreach that does our free HIV, STI testing. They all have a mobile unit. So any of our events that we can go out and do, our backpack. I know they're trying to push a lot of recently the COVID testing and actually vaccines for all the kiddos going back to school that are of age. So we have that capability. We also do our HIV prevention education, and we have our Red Cord program under our health outreach, which is our prostitution diversion program. Next, we have our Pride Center. We are actually ending our Pride Month, which is in June. We have our LGBTQ plus support services there. We have a really cool little lounge area that people can come in and kind of just a safe space to do work or watch movies, meet other people. And then our team there also does the safe zone training. So that's something if you're looking either for your volunteers or your staff. It's a really, really good training just to kind of give an overview.
We actually had him come out.
Oh, you did? Okay,
yes.
Good. That's what I thought. I couldn't remember if I had sent you that or not. But
yeah, he was great.
Yeah, they do a really good job. So that's our Pride Center. Then we have our client services, which is our HIV case management, our behavioral health, which is general counseling, outpatient treatment, substance use programs. Anybody that you know, if either parents or whatever, all of these programs are they're referral based. Some of them do have to come through the clinic first, and then the clinic refers them into all of these different services. But they're really, really, really good, and they take anybody from anywhere. So this is not just, I know our programs are kind of county based, and we have to kind of stick to that, but the foundation does see any and everybody needing services. So we have our youth programs. There's 2 programs underneath this. I guess I should have clicked through this. Sorry. So we have our Project Hope and our Project Turnaround under our youth programs. Our Project Hope sees Clayburgh and Jim Wells County. We will be expanding to Nueces County come the new fiscal year. So we'll have all 3 of those. And then Project Turnaround is in Aransas, B, Brooks, Jim Wells, Clayburgh, Kennedy, Nueces, and San Pat. So Project Turnaround, our prevention specialists that we have here on the call with us, half of them, 2 or 3 of them provide curriculum, presentations, positive alternatives. There's 2 kind of separate that branch from that, our universal program, which is our kindergarten all the way through high school. And then our prevention for the indicated populations, those are a little bit older kids through high school that they do the curriculum to. And right now that's only in San Patricio County that they provide that to. And if Melanie, Stephen, Ezra, if I miss anything or y'all want to add, please feel free to unmute yourself. Okay, so the curriculum that they provide is for YPU, it's the universal services. They engage, like I said, kindergarten, 1st grade through 12th, Too Good for Drugs. Our indicated population is our 6th through 12th graders, which is a curriculum-based support group. Presentations, the nice thing about the presentations that we can provide, we kind of follow these different kind of categories, but really depending on what you're looking for or maybe what's happening with your kiddos or what y'all are seeing, we can kind of more focus on and really provide presentations and information on that. We do goal setting, decision making, managing emotions, healthy habits, coping skills, and then of course the education on underage drinking, vaping, and medication safety or prescription drugs. The positive alternatives. So this is all really kind of like our community type events. So we do movie nights, game nights, arts and crafts, health fairs, the back to school bashes that we're doing this summer, Ribbon Week, and different kind of partnering with the schools for Muffins with Mom, those kind of things, and games. Then we have Project Hope. Project Hope is the coalition, community coalition, and we do prevention education on the use and misuse of alcohol, tobacco, and prescription drugs within Clayburgh and Jim Wells counties. Starting September, like I mentioned before, we will be in Nueces. We do a similar thing, but we try to reach kind of the high school to adult population. We also talk about goal setting, tobacco, vaping, healthy relationships, underage drinking, social norms is a big part of it. And any kind of other little things that mix in there as far as behavioral health promotion. Another big part of Project Hope is our social and environmental policies. So we work with local government and administration to kind of change or improve social norms, social or environmental norms regarding use and misuse of substances. The picture here, I really like this picture because I know one of them that before I came on board, they worked with a daycare, educating about third-hand smoke. And so they sat down with administration and looked at their policy and kind of changed it around, improved it, if you will, as far as when the employees go out to smoke or take a smoke break, when they enter in the building and come back there to change their clothes, because babies can still be exposed and kids to third-hand smoke through your clothing. And so that's just one way to kind of help better, environments for kids and staff and everything like that. So that's an example of kind of the policy changes that Project Hope tries to do. Again, we do community mobilization. So we try to do as many events as we can, just provide information, resources, get the community involved. I know coming up this new fiscal year, we're going to have some supplemental funding coming down from the state that's going to really focus on community resiliency and bringing back the community kind of after COVID, and bringing people out and doing kind of those fun things again, movie nights or concert series and stuff like that. So we're really looking forward to that. That's kind of it in a nutshell. Any questions, comments?
I have a question for you. So that would happen. We do serve 5 counties, so Clayburgh, Duval, Gemmels, Brooks, and Kennedy. I know you cover a few of those as well, especially in Project Turnaround. But I wonder, what is your involvement in the counties in which we serve, particularly Gemmels and Clayburgh? Do you have a lot of, are you guys in here a lot? Do you see our community open and willing to work with you, or because, just generally?
Yeah, so I know I kind of came in after COVID, but towards the end, Melanie and myself were able to kind of connect with Alice ISD and kind of give them, and also Fremont, as far as giving them kind of a rundown of what we can provide as far as services. And we actually were able to do some presentations for the kids and stuff with Alice. Kingsville, we've started Harrell Elementary. The principal has reached out. She's wonderful. Really, really wants to bring as many kind of services and stuff to her school and really get the community back involved. I know that Kingsville is kind of going through a lot of changes with their kind of school system right now. So we have made those kind of connections, but we're all kind of starting new. We all got new measures. So we're all kind of getting back into the swing of things, and schools letting us back in to do stuff in person.
I feel like we really need it here in Kingsville, and there's been pushback for a lot of programs coming in for assistance, but we do have a new superintendent, so I'm hoping that the schools will open back up. The information is really valuable.
Yeah, I know Harrell has been really, really open to it. The other schools, I know I've had some difficulty trying to get into some of the junior high and up high schools and stuff like that. They haven't really been willing to kind of hear us out and let us in, but I'm hoping that'll change coming September, August, whenever they get back.
Awesome.
Anything else? Any other questions? We really we've been talking, the team and I have been talking, and we also have a new director. Her name is Latricia Gunnels. She just started last week, and we're really excited to have her. So amongst all the kind of changes and craziness, there she is, she's with Ezra. We've been brainstorming and really trying to figure out what the best way is to get back into the schools and into the community and get people engaged again. So that's really been kind of our focus these last couple months. So we're excited to, I think, you know, doing the community resource drives and everything was everybody's first real taste of getting back out into the community, and that's been really nice. So
It's
we're
been
excited
super
about
nice. The first event that you had at Coastal Bend College was the first event that I've done during quarantine. So I was just like a kid in a candy store. I'm like, people, there are people here. Anybody else have questions, guys? Now would be a great opportunity.
Yes, any whatever questions, how you can get a hold of us. I put my information up there. Feel free to just email, call. We're really trying to get schedules set up and whatever we can provide as far as services ahead of time, and get back out into the community and just be meeting with people really.
I see you guys have a TikTok. Do you post funny stuff on there or is it just like informational?
No, we try to stay up as much as we can with the times, and that's thanks to Rochelle and the team doing kind of those things. So our social media, we definitely have a presence on social media. We try to do our TikToks. We're on Instagram. We post all of our event stuff on our Facebook. So and especially with COVID, we really had to kind of switch to that gear and to try and stay connected with people. So we have a really good team, in my opinion, as far as social media goes.
Well, I'm gonna have to go check it out.
Definitely.
All righty. Well, if nobody has any questions, I won't keep you. Last
Oh, I
call
think
for questions.
Jody, you have
Go
a
ahead.
question?
Yes. Do you do any kind of training for students who have a GSA in their high school to give them more information or help them out? And also the safe zone training, is that offered periodically or how does that work?
So the safe zone training, I can get you that information. Our Pride Center, what would you call Orlando? Our coordinator over there, he provides that training along with the supervisor, and that's kind of, I'm not really too sure on their schedule, but they're very open. They're trying to get out, especially into the rural communities, to provide that training. And as far as is that the job kind of readiness, or what is the JSA? I'm sorry.
It's a Gay Straight Alliance.
That would be Pride Center. I can hook you up with Orlando and get you all that information. That would be his area. As far as the kids, I would think so. I don't know. Steven might be able, he might know a little bit more. Does Orlando do like kid safe zone trainings? I'm sure he does.
I believe so. I'm not entirely sure what age group the safe zone training is designed for. I know that it's like incredibly informative and important for administration and adults to have that sort of thing. I think the Why Not program is more like geared towards the youth and like connecting those pieces there. That Safe Zone is just like information about that world and the culture about it, so that we're all, you know, appropriate and respectful. Why Not is where these kids get to spend time and in their
together in a safe place.
Yeah.
But I can definitely get you that information or get it over to Nicole so she can get it to you, because I know they're always trying to get out into the community and do stuff. So.
And I have another question here in the chats. It says, what are some benefits that you offer or are available for our teenagers? What about children who are aging out of the foster care system?
So my answer to that would be is a lot of, I think, and correct me if I'm wrong, guys, We do a lot of the like positive alternatives. So instead, and getting kids back engaged into the community, doing healthy, positive type activities, whether it's some, and we've been brainstorming, especially with our new director, Trish, to try and come up with some funner, more fun activities to get the youth involved in, but it's mainly preventative education. We try to do it through activities to make it fun and engaging so they can learn and have, you know, an activity with it. But really, I think with, and I hate to keep going back to this, but with COVID, it's been hard to find a place that is allowing people to gather in that type of setting. So I think this year coming up would be a really, really good time to kind of revisit that and find a location to get the kids involved in a safe space. But yeah, that's, I mean, it's really nice, our program, because we can make it what we want. Depending on kind of what y'all are looking for, we can come up with something cool and fun to keep the youth engaged and all that stuff. Right now we have our Teen Talk going on, which is an online, which Stephen does, which is an online kind of like hour series where they play games, online games, and answer questions and stuff like that. So that's been one of kind of the alternatives for us to kind of get around COVID, to keep the youth engaged through Facebook and stuff like that.
If I can say, just to add to that, logistics has been, like you said, a big issue. Like, where can we get all these kids in one area for a period of time to like do a positive alternative, and to kind of foster those resiliency skills that we essentially teach. And then what are y'all looking for? Where's the need, and what is the specific like topic? I had a school district east of where we're kind of talking about right now, asking me specifically about cocaine and cocaine, vaping, and then self-harm. And I told them, like, we can do a cocaine presentation. We can talk about, you know, all of that. We can talk about, we can do a vaping presentation, but then self-harm, we're kind of reaching into an area that's out of our purview, or at least we're not qualified to speak on. But where's the need? I kind of think that when I look at our program, it's like we have two jobs, and that's like to build and foster resiliency in the youth, and then to take a strain off of whatever school district or agency that we're dealing with. So what do y'all need? What do you see in your specific regions, and how can we develop a positive alternative or a presentation, or even if we could host a 10-week session of curriculum, which walks us through all of those like intensely important, you know, things that we learn in life that I wasn't taught at that age, that I just wish that I, you know, could have learned about managing anger when I was that age, you know, or making decisions and all of that stuff. So logistics, you know, where can we do it? And what do you need? You know, let's talk about that.
I have another question. For some who don't know about Teen Talk, can you elaborate a little bit on how our teens can get involved in participating in that?
Okay, yeah, for sure. So our Teen Talk program is essentially, it's called Summer with Steve, and I stream video games that are prevention related. Right now we're streaming a video game called Smoke Screen, and we play as a new kid to a school, and she's meeting all these people, and they may be positive peers, they may be negative peers. We have to kind of figure that out by asking them questions and going through these little dialogues with them. You will begin to discover whether or not these people are smokers, or if they vape, and then you get to choose to like distance yourself from them. And the closer you bring in positive peers to your inner circle, like the better you become in the game, and this is how you win. But in order for them to participate in it, I would say we can share with y'all our social media, which you can get to from that little tiny CC at the bottom. On our youth programs Facebook page, we share the link to, it's all on Facebook. So if you have access to Facebook, you can look at it on your phone. You can watch it live. We're about to change the times that we stream. So we will likely be doing it on Thursdays instead of Fridays at 3 o'clock. And hop on Facebook. You can, like I said, watch it live, or the recording then gets posted on the wall and stays there. So you can watch it later. But to be involved with, that's what I'm hoping for, is to get kids on, watching, and participating in the chat box, so I can like ask the questions that the game is asking me. I get to ask them and let them give me the input to kind of steer the game. It's been a work in progress, and it's a lot of fun. I try to be silly, but with respect and informative. So, okay, yeah. And Ezra says she just uploaded the flyer. Do note that the time and the day will change, so I can probably get with Marina to get y'all's emails, and I can send out. My coworker Jessica and I are going to work on updating those flyers for this. We're taking this week off, and then we're going to start up again first week of July. So by then we'll have something more concrete we can send out to y'all, and you can share with your youth. That would be amazing, and it'd be a lot of fun.
Yeah, thank you, Ezra. I was looking for the flyer and I couldn't find it on there. But yeah, so mainly I've been sending out in the coalition, I've been sending out the flyer and everything like that. So if y'all are interested, you can definitely get with me, or it's like Steven said, on the Facebook and stuff like that. And it's really about trying to just give kids those life skills and work with them through those kind of things that they're going to experience, whether it's in school or at home. Those kind of things. So
I downloaded the flyer, and I'll be attaching it to the video when I send it out to all the volunteers. That way you guys can have it if you're interested in sharing it with your teens. Anybody else have any questions? Well, all right. I want to thank you so much for being here today, everyone. There we go.
Thank you, Nicole.
I really, really appreciate it. And we got a bunch of thank yous coming in on the chat.
Oh, cool. I can also send you a PDF of this service presentation. That way, for those of them that may want a hard copy or something, then
great.
If y'all need anything or have any questions or concerns, like, please don't hesitate to reach out to us and contact us, and we'd love to come out and be involved any way that we can.
Awesome. Yeah, just send it over and I'll send it out. And I'll include it with this recording.
Definitely.
All righty. Well, thank you everybody for being here. Thank you to the volunteers. Thank you to everybody at the Wellness Foundation, right? Yes, I'm right. I have notes everywhere just to be sure. And I will be sending it out. So if you all have any questions, you can reach out to Marina. Feel free to reach out to me and I can forward information to her. And yeah, thank you so much. We'll talk to you next time.
Thank you.
Bye. Appreciate it.